Welcome to Akhand Vidyashram, the first institute of impeccable wisdom, the walking, talking encyclopedia, the divine design of sympathetic nervous system. My mission, the impeccable wisdom, knowing which everything is fully known. My greatest discovery, Divyank, the divine design of nature with which the perfect objects are designed and created. Divyank is the reward of 60 years of integrated education. Impeccable wisdom is enlightening, and integrated knowledge is empowering. Let's review integrated human nervous system to understand sympathetic nervous system perfectly. All the information from the external world is carried through the sensory division of the somatic and visceral sensory nerves from receptors to central nervous system through peripheral nervous system. Every information which is associated with autonomic nervous system, particularly with respect to the sympathetic nervous system, is carried through sensory division from all over the body. Every receptor in the skin to the internal organs are carrying the information to the central nervous system to be evaluated, and what action to be taken is done by the motor. Motor nervous system has two: voluntary, which takes as the movements, particularly with respect to skeletal muscle exercise. Involuntary autonomic nervous system takes care of all smooth muscles, cardiac muscles, visceral organs, endocrine glands. Involuntary is further divided into sympathetic nervous system and parasympathetic. As I've said, parasympathetic is for rest, digestion, conserve energy for future, which is made of two components. Cranial parasympathetic nervous system, which has 4 cranial parasympathetic nerves: oculomotor, facial, glossopharyngeal, and vagus. And sacral parasympathetic from 3 sacral spinal segments, S2, S3, S4. These 3 nerves go and supply 5 organs. Divyank Ratio. Cranial, 1/3 of the nerves are this. They supply all the vital organs in the body. Whereas sympathetic is to mobilize energy in case of emergency. So with this definition, let's proceed to the next one to understand how these ganglions of autonomic nervous system are developed. The genesis of autonomic ganglion: ovum plus sperm lead to the formation of zygote, which after taking rest for 1.5 days start dividing into doubles, dichotomous division, 2, 4, 8, 16, process. Then come to the stage of trilaminar disc made of 3: ectoderm, mesoderm, and endoderm. Ectoderm is the one responsible for skin and nervous system. Mesoderm for muscles and bones. Endoderm for all the vital organs from inside. That is one prime structure from which we start developing further. Now, ectoderm layer you can see down. One cross section at a particular level and 19 days is shown. That ectoderm layer gets divided into 3: surface ectoderm, which is going to lead to formation of skin; neural plate, which leads to the formation of nervous system; and 2 green parts, which we call it neural folds. They lead to the formation of autonomic ganglia. 22 days, the stage you can see. On 26 days, you find all the 3 become distinct. Neural groove becomes neural tube, and surface ectoderm becomes complete for skin, and these green parts lead to the formation of autonomic ganglia. In other words, migrated neural crest cells become autonomic ganglia. They are not a continuous part of nervous system. They have a different role to play in different parts, but they get connected with the central nervous system and peripheral nervous system through neuron cells. We are going to see that in detail so that we can understand how things happen in autonomic nervous system. This particular picture is very important for us to understand sympathetic nervous system because hypothalamus is the head center for autonomic control as well as endocrine glands. It's very, very important, and as I have mentioned earlier, anterior part of hypothalamus functions of those nuclei are primarily very much like parasympathetic nervous system. That means they are more for rest, digestion, conserve energy, rather everything is on the lower side. Sympathetic system is associated from the posterior part which is close to thalamus, and increase in blood pressure, increase in blood volume, increase in blood sugar level, etc. is centers are there. And why it is there? Because sympathetic nervous system has to come to play a role to save you. The very fact it's called sympathetic nervous system, it sympathizes with the body, come what may. Particular organism should survive. For that, all the information from all over the body, which is carried by ascending tracts to thalamus, and this center is very close, so the immediate information can go to the posterior part of hypothalamus to take immediate action so that we can survive. We cannot wait for. So sympathetic system is very fast, mobilize and do rectification at the earliest. Otherwise, person could die. So that is very close to posterior part, sensory component, and ascending and thalamus. Whereas parasympathetic are slow, they can take their own sweet time. There is no hurry about it. But sympathetic has to be in a hurry. That's why it's close to the posterior part. I'm sure now it makes much more sense why it is posteriorly. And hypothalamus is further very closely associated with insular cortex. I've been saying 8 lobes. No, there should be 10 lobes. 2 are insular. They become a part of central autonomic networking. Hypothalamus is also associated with emotions and other aspects. So as a result, it's hippocampus, amygdala, limbic system, frontal lobe, parietal, temporal, occipital, cerebellum, everything. In other words, all the information from the body is carried up to 4th layer of neocortex, and all the motor component, including involuntary, start from 4th layer of neocortex. That is a loop which is well known. But outer 3 layers are well defined, but no one really knows what exactly. With the help of Akhand Yoga, I've been able to understand and make optimum use of 3 outer layers, activate them, integrate the system. As a result, I am able to bring even involuntary autonomic functions under my superconscious voluntary control. And this is the reason why I'm emphasizing this. If you can lift your consciousness to that, activate the outer 3 layers, and you can even bring involuntary autonomic functions under voluntary control, superconscious control. And that is what yoga is all about. No wonder yoga, people who understand yoga, yoga clearly lead a much more healthier physical, emotional, mental, spiritual, otherwise a complete life, a full package. And this is what I'm trying to emphasize on. So now let's move on to the next. Now this particular picture of the sympathetic is what I am going to explain step by step. In cranial parasympathetic nervous system or parasympathetic nervous system, you will find preganglion neurons are long and postganglion are short. Whereas in sympathetic, preganglion fibers are short and post are longer. Neurotransmitter for parasympathetic, both preganglion and postganglion, it is acetylcholine. But in sympathetic, preganglion is acetylcholine, nicotinic receptors. Post, it is noradrenaline or norepinephrine. That difference is there. But now you must be wondering why I have shown blood vessels, not organ to be supplied by sympathetic system. Simple, clear. All the cranial parasympathetic or sacral parasympathetic, they supply the vital organs of the body, chest, abdomen, pelvic region. They are also supplied by the sympathetic nervous system, but sympathetic nervous system gets information from all over the body, from top of the head to the sole. And also remedial action is also done throughout the body. So fibers of post-ganglion fibers of sympathetic nervous system travel along the blood vessels to almost to every part of the body. Wherever their blood vessels go, sympathetic fibers are there. Only then they can do the sympathetic work or rectification spontaneously, immediately, without a delay. So importance is very, very thick. That's the reason we got to keep it in mind. These ganglions, particularly with the prevertebral, they flow along aorta, and the vessels which come out of that, they travel along with that. Now, to make that thing very clear, let's go to the anatomy part of sympathetic system. Origin. Preganglion fibers originate from 14 spinal segments. Number 1, thoracic 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 segments of thoracic plus lumbar 1, lumbar 2. There are 14 segments from T1 to L2 are the only segments from which preganglion fibers of sympathetic nervous system arise. In other words, you have 28 preganglion nerve fibers, 14 plus 14 on either side. What is interesting is the distribution wise. These 14 plus 14 preganglion fibers created two chains, left paravertebral chain and the right paravertebral chain. And interesting enough, both the chains fuse at the bottom in the pelvic region to form ganglion impulse or coccygeal ganglia. And what is interesting is 28 nerves lead to the formation of 45, 22 plus 22 plus 1, 45. And 45 divided by 28 is what is Divyank ratio. Is it a coincidence that such a vital system which takes care of all the functions automatically, spontaneously, is designed with the most beautiful divine design of nature called Divyank? Is it a coincidence? Or everything perfect has been done, and that is exactly what I'm trying to do through my videos to emphasize that is the divine design of nature. Now, having got 14 segments, 28 nerves, 45 ganglion of paravertebral nature, then you the same fibers also come through these ganglions to form a prevertebral chain. There are 4 plexuses right in front. They are in front of aorta, right in the middle. And there are 4 cardiac plexus, celiac plexus, celiac ganglion or solar ganglions or solar plexus, superior mesenteric ganglion or inferior mesenteric ganglion. Now, what are the functions of these particular things? Let's understand very clearly. Paravertebral things first. The top endocrine gland to which there is sympathetic blood supply is pineal gland. As you can see, right on by the side of eye is a pineal gland which is supplied by the sympathetic fibers from superior cervical ganglion. And the next one go to iris pupil for dilatation. When a sympathetic system is on, pupil will be dilated and more light can go. Lacrimal gland, reduction in tears. Mucous membrane of the nose and palate is also by superior. Sympathetic system will reduce the mucus formation. Saliva is also reduced. Mucus formation in the mouth, pharynx, larynx also is reduced when there is sympathetic overactivity. Even parotid glands, saliva will come down. So these functions are exactly the opposite of what you see in oculomotor, facial and glossopharyngeal, three cranial parasympathetic nerves. Those opposite functions are done by this particular thing from superior cervical ganglia. So I'm sure things are very clear. But when it comes to the remaining this prevertebral, they are primarily associated with the vagus nerve of the parasympathetic nature on top, particular three zones: cardiac, heart, chest, pulmonary functions, vagus, celiac ganglion or solar, which is for digestion, spleen, is again the vagus nerve. But at this particular juncture, let me also highlight almost all the vital organs of the body, chest and abdomen and pelvic, are supplied by both sympathetic and parasympathetic. But spleen is supplied by only sympathetic, not parasympathetic. The reason is, in case of blood loss and person is going to die, 150 ml of blood from spleen can be brought into general circulation with the help of sympathetic overstimulation and squeezing the blood out of spleen. What a wonderful work. And then small intestines, up to digestion, it is vagus nerve as the parasympathetic is concerned, or superior mesenteric as far as sympathetic is concerned. So from that point of view, I think picture is very, very clear. Now, functions, physiological functions, as you say, pupil dilate, no tears, dry mucous membrane, no saliva, high respiration rate, bronchodilation, increased heart rate, high heart contractility, high cardiac output, high blood pressure, panic attacks, stress and strain. That is as chest is concerned. Then comes to the stomach, juices are less, digestion is defective, reduced digestion, belching gas, and because the pancreas opposite with sympathetic will increase the blood sugar level, whereas vagus will reduce blood sugar level. Irritable bowel syndrome is associated with sympathetic overactivity. Adrenal issue also with adrenal gland and sympathetic system. Bladder relaxation, dystonia, profuse sweating, and impotency. These are other physiological functions of the sympathetic nervous system. But here I want to lay one emphasis which is very, very important. We saw sacral parasympathetic system. There are three nerves arising from S2, S3, S4. They go to form nerve origin and they supply 5 organs. Similarly, as you can see in this, there are 3 fibers coming from the lower part of vertebral ganglion through paravertebral to form inferior mesentery, and they supply 5 organs, same organs which are supplied by sacral parasympathetic system. If they for more for reproductive health, and this will just do the opposite. This is where I do find Tantra has helped me to understand better that apana prana, the things which expel all the things from body, is done by the sympathetic system, not by the parasympathetic. I am quite sure that parasympathetic supply to the kidneys, bladder, ovaries, uterus, penis, and ovaries is very, very restricted, but more prominent is the sympathetic supply. And I hope that over a period we will be able to find this research and bring the results to fulfill this particular thing, because I would not like to put on record something which I have not conclusively tested by my own self. This is my hypothesis. This is how it is. Leave it at that. So from that point of view, I think we have more or less covered the entire sympathetic system, which can help us to understand concept very, very. Now, sympathetic dilatation, this picture I'm repeating just to show, is opposite of oculomotor. Same thing, reduction with the digestive system is also something I will not spend too much of time. And cardiac plexus stimulation with sympathetic is increasing. The opposite of vagus is something also I'll not go into detail in this. We will discuss that in the next video in a much more detail. Now coming to the end, I am glad that I had been, what I started with the autonomic nervous system, cranial parasympathetic, its anatomy and physiology, sacral parasympathetic, anatomy and physiology, then sympathetic, counter the effects of sympathetic and parasympathetic, and balance of that is important. And I think the gist of that I have brought it down very clearly in these two things. And this particular picture, all said and done, entire Tantra revolves around endocrine glands and autonomic nervous system only. And these both Ida and Pingala nadis are nothing but two sides of chains, vertebral column, spinal cord, and all that. We'll not go into detail. We will discuss that as we proceed. But I am glad that I have been able to put across some of those things which have not been covered by others. So let's build up one by one thereafter. So thank you very much for kind listening. Thank you.